Hi. Do you mind telling people who you are?
I'm Jonathan Cohen, and I am the director of the public health program at the Open Society Foundations in New York.
Thanks. It's really great to have you here in our virtual world. And as I sit here in California, I guess I want to start, if you wouldn't mind, by just saying a little bit of, COVID has been so big in all of our lives. And if you could just say something maybe about how has COVID affected you personally and the impact it's had in your own life.
Of course, it's not just COVID, right? It's COVID in a year of profound injustice in other spheres. It's COVID in a year of global reckoning with anti-Black racism. It's COVID in an election year in the country, in the US, which has been a test of resilience of a democracy against authoritarian government. And I think it's really the combination more than COVID itself. I think for one thing, it's actually brought me closer to public health. COVID has made me feel more than ever that public health is a profound political enterprise.
If you think about your work, is it therefore changing how it is that you're doing your work? Is it changing kind of the way that you think about kind of what the work is of your program, but also the work that you personally do?
I think it is. I think it's made duality between orthodox public health work, advocating for prevention programs, treatment programs, behavioral interventions on the one hand, and on the other hand, advocating for social, economic, political, legal conditions in which people can enjoy health on the other. It's actually made that distinction when I find myself saying and putting philanthropic capital behind the idea that a vaccine is the one thing that stands between the world and its economic thriving, right? And then the next day I'll be saying there are no magic bullets in this pandemic. There is no biomedical solution, and we are kidding ourselves if we believe in vaccine solutionism. It is only by changing the conditions. So that duality, which you could argue is very complementary, two wings of a bird, has been pronounced, and it's been confusing.
Do you think that the communities that you work with are experiencing the same thing? Do you think there's a lot of push right now? Everybody's talking about the vaccine, the vaccine, the vaccine. Everybody's also talking about what's it going to take for people to have equitable access, and how do we think about using human rights frameworks and other ways of actually thinking about the criteria that are needed. But I'm also kind of wondering, do you think people are grabbing onto the magic bullet, or do you think that people are really kind of thinking about the broader picture?
I think both. What has been challenging is that people who would normally be insisting on the broader picture have been, in a sense, thrust into vaccine advocacy, therapeutics advocacy, testing advocacy, because this goes back to your first question about how COVID has affected me personally. We're scared. And it's hard not to be seduced by the idea that a vaccine is the path back to normal until you recognize and remind yourself and realign yourself with the idea that we don't want to go back to normal, right? That's the social justice claim, that normal was oppressive for the very groups who are most affected by this pandemic.
So what do you think about kind of the use of being able to talk about human rights frameworks or human rights approaches to being able to think about what equitable access would mean? Do you think that that's something that's going to take us somewhere? Or do you think at this point, people are so focused on basically the vaccine and distribution without those issues, and that traditional public health is going to make it work? Or do you think that traditional public health is going to need the human rights concepts that are going to be part of kind of being able to make sure that the vaccine really gets to everybody who needs it?
I think from a normative theoretical perspective, human rights is doing incredibly important work in drawing a distinction between what we would call a people's vaccine, where, the medical knowledge that R&D is part of a commons, where the distribution is according to clinical criteria only, where pharmaceutical companies disclose their contracts with governments who are participating in clinical trials, versus the traditional pharmaceutical business model, where pharma extracts publicly funded research and makes a killing. So I think human rights is incredibly important for setting up that distinction. and for creating a set of demands, which many of us refer to as the people's vaccine, which is, I think, best motto we have to sum up the human rights approach. Unfortunately, I think we're losing. I think that if you look at the COVAX facility, if you look at the multilateral efforts to raise money to distribute the vaccine equitably, it feels to me like a lot of wealthy countries hoarding for themselves and poor countries getting the scraps. And big pharma absolutely retrenching and consolidating its business model and doing a very successful job of casting themselves as our savior.
This goes back to just thinking in terms of policies in general, right? And it's kind of looking at kind of what's been happening, I think, both domestically in the US and internationally, beyond thinking about the vaccine, but just in the context of COVID generally. Personally, there are so many policy decisions that have been made that I think are concerning and that I think are problematic. And then there are some that seem like, okay, this actually may be useful. And I feel like COVID is being used almost in a double-edged way. In one way, it's kind of opening space. And in other ways, it's shutting down spaces in kind of a significant way. And I just wondered, for you, like you see kind of, you have a global eye on things in terms of kind of what's there. And I just, what kind of concerns do you have about what's happening with policy, both domestically and internationally?
Look, very early on, I think we identified a series of policy spaces that were exactly as you described them. On the one hand, enormous opportunities to do things differently, and on the other hand, real risks of retrenchment, right? So a great example is prisons. You know, of course, COVID hit. We all knew the mixing bowl effect. Prisons are an incubator. Here's the opportunity, the generational opportunity for humanitarian release, for pretrial reform, for bail reform, get people out of prisons, right? We're in New York City. There's a whole campaign to close Rikers, the largest jail in the city. It's going to be accelerated by this. There was momentum. Some jurisdictions started to do it. Weeks later, months later, hardly anybody released. Now we're reading in the United States that the CDC is even daring to debate whether prisoners should be prioritized for a vaccine. So that kind of incredible transformational opportunity. Migration is another one. I mean, here's an opportunity to make the point that when the EU and Turkey bargain away the human rights of refugees, it has disastrous public health effects. It's time to renegotiate that deal, close those camps, give those people a solution. Of course, nothing. COVID-19 was going to mean paid sick leave. It was going to mean occupational health and safety standards. Yeah, here and there a little bit, but far from the transformational opportunity. In some ways, where all of this takes us is to the policy issue that hangs over all of this, which is democratic reform. So issues of money in politics, lobbying, voter suppression, the kinds of things that ultimately determine whether the will of the people and whether this appetite for transformation actually prevails or whether vested interests just have their day.
I super hear you. And unfortunately, I super agree with you. One of the things that I've taken a certain particular positive feeling about is seeing what communities are doing in terms of kind of how people are responding and just kind of just looking in general and trying to, and I just wondered in terms of, again, from kind of the view that you have, you know, when you think about communities, and you could also talk about governments if you want, or the UN, but really focusing kind of on communities, like, you know, what have you seen that have been really positive in terms of effects to kind of address COVID?
There is clearly no epidemic in the history of public health that has taught us more about the power of communities than HIV. And, you know, to her credit, it was Deborah Burke, a Trump appointee, who said early in her tenure as coronavirus coordinator, this is not the first silent epidemic. AIDS was a silent epidemic. People were transmitting it asymptomatically who didn't know they have it. And what do you need against a silent epidemic? You need communities. You need those social networks. You need the solidarity. You need people breaking the silence. You need people breaking the shame, supporting each other to make healthy choices, identifying the things in their lives that make that difficult. That's communities. The Biden team needs to learn from the experience of grassroots communities in other countries. And which countries? Not the advanced democracies, the Canadas, the New Zealands, the countries that face the same kinds of racism, disinformation, discrimination, denialism that we face.
I mean, clearly there's important things that we as a society need to learn from this, right? And if you think about your experience and if you think about our collective experience, you know, so if we're talking about going forward, what are some of the key lessons you think that we should all be keeping in mind?
I mean, I think even those of us who knew all along how political health is would be lying if we didn't say that we've learned how political it can get. I mean, the way that wearing a mask was so effortlessly and disastrously politicized in so many countries that it became a badge of political allegiance. Of course, this isn't new, but I'm not sure we fully appreciated just how potent health can be as a political weapon by people who are willing to weaponize it in that way. HIV was an epidemic in gay and bisexual men, in women in intimate relationships who didn't have control over their bodies, in prisoners, in sex workers. COVID is an epidemic in essential sacrificial workers, in people in nursing homes, in people in prisons and other congregate settings, in people who for all kinds of reasons can't follow so-called public health advice to socially distance, to wash their hands, etc. I think we have learned of a whole new way in which a pandemic can cast that light on inequality.
And that's a key lesson kind of for all of our work going forward. I'm also particularly obsessed right now with the question of the ways in which public health and security have become intertwined through COVID and kind of what that means. And so thank you. This is the kind of conversation that could go on for a long time. It's a pleasure to talk to you.
Thank you.